You know when you get that routine cholesterol test? You probably think you're getting the whole story on your heart health. But what if that standard test has a massive blind spot? Today, we're diving into 3 specific blood tests that everyone, and I mean especially those of us over 50, really ought to know about. These are tests that could give you a much clearer picture of your actual risk for a heart attack or stroke.
The whole reason we're talking about this today is because of a story from a listener named Elton. He truly believes that if he'd known about these 3 tests, he might have completely avoided a stroke. But they weren't part of his normal checkup, and he only ended up getting them 5 years after the fact. His story really hits home, you know? It makes you wonder, what are we all potentially missing? And could knowing about it actually change our future? Alright, so what's the big deal with the standard test? We all get the typical lipid panel, and don't get me wrong, it's useful, but it just doesn't tell the whole story. It's kind of like judging a book by its cover, and when we're talking about something as serious as heart disease, you really want to read every single page.
So your standard panel measures the total mass, the weight of things like good HDL and bad LDL cholesterol. But here's the catch. It can completely miss the actual number of harmful particles carrying that cholesterol around. It tells you absolutely nothing about your specific genetic risk factors, and it doesn't measure that low-grade simmering inflammation that can really fuel plaque in your arteries. And believe me, those 3 missing pieces, they're absolutely crucial.
So that brings us to the first and honestly maybe the most important advanced test. It's called Apolipoprotein B, or for short, just ApoB. The best way to think about it is, instead of weighing the luggage, this test counts the number of suitcases.
So what exactly is ApoB? Think of it like a little protein handle that's attached to every single one of those dangerous artery-clogging particles floating around in your blood. An ApoB test doesn't guess, it doesn't estimate, it gives you a direct head count of every single one of those particles. And the logic is simple. The more particles you have, the more chances there are for one to smash into your artery wall and start causing trouble.
Okay, this is a fantastic way to get your head around it. The standard LDL-C test is like trying to guess how bad traffic is just by knowing the size of the cars. You might have a few huge trucks, or you might have 1,000 tiny little cars. You just don't know. But the ApoB test, that's like a traffic camera that counts every single vehicle on the road. It gives you a way more accurate picture of how clogged things might get.
So what's the number you need to look out for? Well, most cardiologists would say a level over 130 milligrams per deciliter is considered high and means you're at a greater risk. And for people who already have heart disease, a lot of doctors are now shooting for a target way down below 70. Knowing your number gives you a clear, actionable goal.
And according to the experts at Harvard Medical School, this test is especially critical for certain folks. If you have any signs of what they call metabolic syndrome, things like diabetes, obesity, even just a large belly, your standard LDL test can actually look misleadingly normal, while your ApoB is sky high. And it's also a must-have for anyone with a family history of heart disease. All right, let's switch gears to the second test. This one is really fascinating because it's all about a risk factor you're pretty much born with. It's called Lipoprotein A, or Lp(a) for short. Now, this is a really powerful statement. Unlike other cholesterol markers you need to check over and over, many experts are now saying that every single person should get their Lp(a) checked just once. And you might be wondering, why only once? Well, it's because the number you have as a kid is pretty much the number you're going to have for the rest of your life. And here's why that's so important. Lp(a) is often described as a sticky version of LDL cholesterol. And that stickiness makes it way more likely to cling to your artery walls, which speeds up plaque buildup, turns up the dial on inflammation, and can even promote blood clots. It's a real triple threat.
The key takeaway here is that this has almost nothing to do with your diet or how much you exercise. Your Lp(a) level is about 90% genetic. It gets locked in when you're a little kid and it just stays there. And get this, even statins, which are amazing at lowering LDL cholesterol, they don't touch Lp(a). It's a hidden genetic risk factor that you can only find out about with this one specific test. The number to know here is 50 milligrams per deciliter. If your level's above that, your risk of having a heart attack could be 2 or even 3 times higher, no matter what your other cholesterol numbers look like. And that's exactly why it's so critical to know what your number is. Okay, so we've counted the particles, we've checked our genetic lottery ticket. The third and final piece of this puzzle is inflammation. And we can get a read on that with a test called high-sensitivity C-reactive protein, or just hsCRP.
Now, hsCRP is basically a general marker of inflammation in your body. We're not talking about the inflammation you get from a cut or a sore throat. This is about a chronic, low-grade inflammation that's just simmering away in the background. And that kind of inflammation is a key ingredient in the recipe for heart disease. It helps plaque form, and even worse, makes it unstable.
And look, this isn't some fringe idea from the internet. While older guidelines were a little wishy-washy, the latest recommendations from the big guns, the American Heart Association and American College of Cardiology, they now officially support using all three of these tests, ApoB, LPA, and hsCRP, to get the clearest possible picture of someone's heart risk.
So this is the million-dollar question, right? If these tests are so important, why aren't they standard procedure? And how do you actually go about getting them? Let's break it down.
It's the obvious question. If this information is so valuable, why isn't it just part of every yearly checkup? The answer, unfortunately, really comes down to slow-moving policy and just inertia. A huge part of the problem is that current Medicare policy, which a lot of private insurance companies follow, is based on a report from all the way back in 2009. Can you believe that? That report said there wasn't enough evidence, but since then, a mountain of new research has come out. And like we just saw, major new guidelines do recommend these tests. The system just takes a really long time to catch up. Now, that might sound a little discouraging, but don't let it be. Even if your insurance doesn't automatically cover them, you can often get these tests done for a really reasonable out-of-pocket price. You can find an ApoB test for under $100, and the LPA test is actually covered pretty frequently.
So how do you actually bring this up with your doctor? Simple. Be direct. Don't just ask for a cholesterol test. Ask for ApoB, LPA, and hsCRP by name. Make sure you remind them of any family history of heart disease because that's a huge reason to dig deeper. And finally, just ask them straight up about the cost and what your options are. Being informed is half the battle.
And that's really our main takeaway today. Look, you might have to be a little assertive. You might need to be your own best advocate here. But getting the full picture of your heart risk with these three tests, counting the particles with ApoB, understanding your genetics with LPA, and measuring inflammation with hsCRP can give you information that could be genuinely life-saving. These are all important tests that every senior should really have at least once.